Good morning, everyone. Welcome to the Cinco de Mammo Virtual Health Talk Women's Health. This is the first webinar of the Health Talk series for 2021. My name is Diana Hualpa from the Hidalgo County Wellness Program, and I'm glad that you joined us today. Before we get started, I want to make sure that the technology is working for us today. If you can see the slides clearly and if you can hear my voice clearly, would you please click on the raise hand icon that is located on the bottom of our Zoom webinar software. Again, if you can see my slides clearly and if you can hear my voice clearly, if you could please click on the raise hand icon that is part of our Zoom webinar software. Thank you so much. It looks like we're good to go technology-wise. I have a couple of reminders before we get started. Reminder number one is that this month we have 2 additional webinars. Next week, we have our Building a Culture of Respect webinar, and the following week, we have the Healthy Mind Toolkit Boosting Your Mental Health webinar to honor Mental Health Awareness Month. Therefore, if you haven't registered for the upcoming webinars, I invite you to do so through our website after this webinar. Our second reminder is that you are on listening only mode. However, you are able to submit your questions via our Q&A forum on our Zoom webinar software. At this point, I have the pleasure of introducing our guest speaker for today's presentation, Dr. Audrey Gutierrez. Dr. Gutierrez graduated medical school from the University of Texas Medical Branch in Galveston in 2017 and completed family residency from Cristo Santa Rosa in 2020 as co-chief. Dr. Audrey Gutierrez is board certified in family medicine and currently serves in the South Texas Health System clinics. Without further ado, I pass it over to you, Dr. Gutierrez. Good morning.
Hi, good morning.
Good morning, Dr. Gutierrez. Thank you so much for joining us this morning.
Okay. Okay, perfect. Let me go ahead and get my presentation up. Good morning, everyone. I'm Dr. Gutierrez. Okay. Can you see that, Diana?
We cannot see the slides yet.
No.
We're gonna go ahead and start shortly. We are just having a couple of technical difficulties, but we're gonna go ahead and start shortly. Thank you.
It looks like I'm trying to share my screen, but it's not letting.
Okay. Would you try one more time, Dr. Gutierrez?
Thank
you.
Okay. Can you see my screen?
Yes, we currently see the PowerPoint screen. Yeah.
Okay, perfect. Okay. Is it full screen now?
Yes, Dr. Gutierrez, we're good to go.
Okay, perfect. Well, good morning, everyone. My name is Dr. Audrey Gutierrez. Thank you for that introduction, Diana. So I really enjoy women's health. I am a family doctor, but I do enjoy women's health a lot, and especially preventative care for patients. I think that's a really, really important thing, being a family medicine doctor and trying to help patients and preventing things from happening. And so again, this morning, we're gonna be doing women's health and then with some emphasis specifically on mammograms, because it is Cinco de Mammo, and I'll talk a little bit more about that later. So the reason why it's so important to get preventative care, especially preventative care that has to do with cancer screenings, is because, as you can see, as you tend to get older, you know, in the female category, cancer becomes the #1 problem why females die. So if you look from the ages of, 1-year-old to 19 and then 20 to 44, you see that unintentional injuries are the leading cause of death. Now, those are normally your car accidents. And then as you get older, between 45 to 64 and 65 to 84, cancer becomes the #1 cause of death. And so if we can, catch these cancers early, that's the best way to do it. Because if we do it early, that means that there's probably going to be less, surgeries, maybe even not even needing chemo or radiation, and things of that nature. And then as you get older, heart disease does become the #1 cause of death. And then things like Alzheimer's. So, overall, just really, really important to get preventative health for your heart, for your heart prevention, for your cancer prevention, and things like that. And so the way that I broke it down was into age categories. This is how I kind of like to think about annual visits for women when they come in is, what category do you kind of fit into? And so, from the ages of 18 to 39, the main things that we like to look at when we talk about, preventative care and women's health is these things listed here. And so, talking about alcohol and smoking. So we all know that smoking is not good for you, for anyone. And so we like to counsel on early to stop smoking as early as possible. And then the less, years that you smoke, the less that you will likely get that nicotine addiction. So we like to talk about, tobacco cessation, and then specifically alcohol, because people in this age category do tend to be more at risk of things like binge drinking, which is 4 or more plus alcohol drinks in one sitting. And so, we definitely like to counsel that alcohol in moderation is fine. And even though, glasses of wine have been proven to have some heart healthy things to them. But, counseling on healthy alcohol use, making sure, you're not binge drinking, you're not having alcohol overdoses and stuff like that. The second thing is blood pressure. And so normally we don't see too much, elevated blood pressure in this category. However, if it is starting this young, it definitely is something that needs to be monitored. Now, we say that normal blood pressure is 120, that top number, over 80. Anything between 121 to 129 on the top number, and 70 to 79 is considered that kind of in between range. It's not quite high blood pressure, but you're not quite, below that 120 over 70. So this is a time to do, counseling on, what are the things that causes high blood pressure? So salt intake causes high blood pressure. Smoking causes high blood pressure. Lack of activity, poor diet causes high blood pressure. And then there are other things, that are more rare that we can find in this age group that cause high blood pressure. And then, so anything above 130 over 80 is considered stage 1 high blood pressure, and anything 140 over 90 is considered stage 2 high blood pressure. So we like to, again, counsel on blood pressure in this time. A clinical breast exam, I normally ask my patients, if they would like me to do a breast exam during the visit. Most of my patients say yes. And what it is, it's just feeling for anything, lumps or bumps, any lymph nodes that I can feel in the area. And then next is the Pap smear. Now, Pap smears, we don't recommend for anyone less than 21. And so we recommend at 21, just because there hasn't been any data to show that doing it less than 21 is any more preventative than starting at 21 years old. And so at the Pap smear, what it is we go and look in the cervix. We use a little brush to gather some cells from the cervix and take a look. Do the cells look normal? Do they look a little bit abnormal, or do they look very, very abnormal? And so if they look normal, normally we don't like to repeat Pap smear until 3 years because there's really, the Pap smears are not the most comfortable exams. And so if we don't need to do it, if it's not going to benefit the patient, then, really it's every 3 years. However, if you do come back with an abnormal Pap smear, there is something called HPV that we can see if you do have abnormal cells on your cervix. And HPV is a virus, human papilloma virus, that can increase your risk of having cervical cancer. Now, the reason why we don't normally screen women, from 21 to 29 automatically with HPV is because a lot of the times women in this age group tend to clear the virus very easily and it doesn't come back. However, if you have abnormal cells, that may be because you have HPV, and that's why we do it that way. But again, very important to start getting your Pap smear at 21 and then every 3 years as long as they're normal. If it is abnormal, we normally screen anywhere between 6 months to a year to see what's going on. The next thing that we like to look for at this time are any STIs, or sexually transmitted infections. And so along with checking for STIs, that's like your gonorrhea, your chlamydia, your syphilis, we also like to do counseling on, how to prevent these sexually transmitted infections. And so counseling on good protection with condoms, and then, making sure, your partners and your partner's partners and things like that. So we like to do this in this age as well. Depression screening, that's where we go and look to see if there's anything that's affecting your mental health, it's affecting your daily life. And so that's a quick screen that we do. We recommend your tetanus shot to be every 10 years. And that's really for everyone. And you'll see that as we continue to go through the age groups. Exercise and diet, especially if you're having some elevated blood pressure, and if you have elevated weight or what's called BMI, I like to talk definitely about, what does your daily diet look like? Are you getting, the right amount of vegetables and fruit? Are you trying to avoid those processed fruits and eating as much natural things as possible? And then your exercise. Everyone should really, unless your doctor says otherwise, should be getting about 115 minutes of aerobic exercise a week. So if you split that up, that's about 30 minutes, 5 days out of the week. And then last but not least, plus or minus labs. And so really for our younger patients, if they're not overweight, if they don't have any risk factors, we can really wait on lab work. Now, once you start to get into your, late 20s, 30s, you have risk factors, you have family history of diabetes, hypertension, which is almost everyone here in the Valley. We do encourage to get labs that check for, cholesterol, check to make sure you don't have diabetes. And then for women who have heavy cycles, we also like to make sure that you don't have any anemia, to where we would need to be, looking, do you need birth control to be, helping with this, your heavy periods? Do you need an iron supplement to, supplement because you do have anemia? So those are the labs that we tend to do, plus the STD screening in this age group. Now, taking a look at the next age group, women from ages 40 to 49, it's a lot of the same things that we talked about, between the ages of 18 and 39. It's your alcohol and tobacco screening. It's your blood pressure, definitely making sure to get your Pap smears. Now, the Pap smear does change a little bit when you get into your 30s. So when you get to 30, we automatically check for those abnormal, the cells on the cervix plus an HPV. If those two things are normal, we don't really recommend to repeat your Pap smear unless you're having symptoms, you have new sexual partners, until every 5 years. And that's shown, to not put the women to have a Pap smear every year, but short enough to where we're not going to be missing any cervical cancers. Now, there are women who decide, I do want to continue doing my Pap, even though, there are guidelines, that say otherwise, and that's fine. There's no problem if the patient wants to continue doing their Pap smears every year. It's just an exam that isn't quite that comfortable. So that, those are the guidelines that I recommend. Again, we're looking for, sexually transmitted infections. And really during this age group, it's really at, if you're at risk. If you've been married, you don't have any worries about having any STIs, it's something that is not needed. Now, I always counsel my patients, is this something that you think you need? And then we go from there. And then again, depression screening, your tetanus, talking about exercise and diet. And then some new things that pop up, at the ages between 40 and 49 is plus or minus your mammogram. And we'll go ahead and talk about the guidelines a little bit later. But this is the age group to really talk to your doctor, am I at risk person to start having my mammograms at 40? Do I need to start at 45 or do I need to start at 50? So this is always a conversation I like to have with my patients, looking into their history, seeing their family history of breast cancer, ovarian cancer, uterine cancer, and all of that. So we'll get into that a little bit later. And then the other thing too is, plus or minus colonoscopy or screening for colon cancer. And so the guidelines for colonoscopy used to be that we start screening everyone at 50 years old. More recently, they're seeing that there's younger patients that are starting to have polyps or abnormal tissue in their colon. And so more recently, the Gastroenterology Association has really recommended to try starting screening at about 45 years old. Now, a lot of insurances don't recognize this right now, and hopefully that'll start changing in the next couple of years. So right now, everyone should at least get a colonoscopy at 50, but guidelines are changing, and it may start that we may be starting at 45 years old. Now, of course, if you have anemia and you're not sure why you have anemia, or if you have any family members that were diagnosed with, colon cancer, what we recommend is to have families screened 10 years before that family member was diagnosed. For example, if your family member was, an uncle, a cousin, your mom, your dad, your brother, your sister, were diagnosed with colon cancer at the age of 45, that means you should be getting your colonoscopy 10 years before that. So that would be at 35. And so it's always really, really important to let your doctor know, your family history as far as cancers. And that's something that I like to ask about, when I'm going through the family history, what tends to run in your family? Are there any cancers that run in your family? And then of course, do you have, family history of diabetes, hypertension, high blood pressure, high cholesterol, and things like that. The next category, as far as women's annual exams and health, would be, from the ages of 50 to 64. And so again, if you look on the left side of the screen, it's all of the things that we talked about before. It's your alcohol, blood pressure, depression, tetanus, exercise, diet. And then of course, this is where, your mammogram, 100%, everyone who is 50 or older needs to have a mammogram. And then the other thing too, that is new in this category is plus or minus your DEXA scan or your bone density scans. That's the first thing on the column on the right side. And so DEXA scans, what it is it's an X-ray, and it takes a look at the density or how strong your bones are. And so normally for women, we don't recommend DEXA scans until about 60 or 65. However, if you have risk factors, and we'll talk about those later, that put you at more risk of having brittle bones, you may need to have a DEXA scan, as early as 50, 55 years old. So again, talking with your doctor, making sure that this is, is this something that, you need based off of your own medical health. Going down to the colonoscopies, again, at 50 years old, everyone should have a colonoscopy. And if you don't feel comfortable, it is a process, it is a procedure where you do have light sedation. It is a pretty quick procedure. The worst part that my patients tell me is the prep for the colonoscopy. So, you drink some fluids and it makes you go number 2 as much as you can. But it's really important to have a good prep or a bowel prep where you flush everything out. Because if you don't, when the specialist goes in, the gastroenterology specialist, if you don't have a good prep, he's not going to be able to see your colon and can potentially miss little polyps. And so it's very, very important to make sure that you have a good bowel prep before your colonoscopy. Now, there are other things that you can do as far as screening for colon cancers. So there's, yearly screenings where we give you little cards to test for any blood in the stool. There's also little kits that we use that look for cancer DNA. Now, when you use these kits that use for the DNA for cancer, it's a little further in the process. That means that there's already cancer present. And so I encourage colonoscopies because during the colonoscopy, the GI doctor can find a polyp, which can be a pre-cancer, and take that polyp out before it even gets to be a cancer. So that's what's really good about the colonoscopy, is that they can take those things out before they even become cancer. I do recommend, of course, labs, in this category as well. That's checking for, your kidneys, your liver, your cholesterol, your blood count if you have history of anemia. And then depending if you have other things, your thyroid, and vitamin D and other things like that. Another thing, is plus or minus cancer screening. If you are a longtime smoker, that is something potentially that you will need. And then of course your vaccinations. In this age group, the things that I like to talk about, of course, is your tetanus every year that we recommend for everyone. But then also your shingles vaccination that you can get as soon as 55 years old. The newer shingles vaccination is a 2-dose series, but we've seen that it works a lot better than the older vaccine that was just a 1-dose. And so your shingles is, very important. Now, for those who don't know, shingles is basically a herpes virus. If you've had chicken pox as a child, what happens is that virus goes and hides in your body. And during times of increased stress or, just where your body's defenses come down, you can have that virus come out in the form of shingles. And so getting your shingles vaccine is really important. And if you've had shingles already, you can still get the shingles vaccine. Very important for patients. Now, women who are 65 plus, of course, your mammograms, plus or minus your Pap smears. At this age, you've had a long span where you've been getting Pap smears. And so, if you've never had an abnormal Pap smear in your life, or have had normal Pap smears for most of your life and, only had an abnormal one in a very early age, we can, we have a discussion, do you really need to continue your Pap smears? At 65, if you've never had an abnormal Pap smear, that's something that you don't need to continue doing. Mammograms, we still, recommend during this time. And then colonoscopies, again, we recommend to this time. Colonoscopies, if they're normal are every 10 years, if they're abnormal about every 3 to 5 years, and then severely abnormal maybe every 1 year. But their guidelines recommend that anyone 75 or older, this needs to be a conversation with you and your doctor, or you and your GI doctor. Is a colonoscopy going to benefit you? Now, if you are in great health, you definitely can continue getting colonoscopies. If you feel like your health, is not that great, if we feel like it's not going to benefit you, then it's definitely something, it's a process. You have to do the prep, you have to go in, it's a procedure under light sedation. If we don't feel like you would get any benefits, that's definitely a discussion to have. And then, of course, again, your DEXA scans. We definitely at 65 years old recommend that women get their DEXA scans to, see how strong the bones are. Make sure that there's not any weakening of the bones called osteopenia, or even, more severely brittle bones called osteoarthritis. And then at 65, we also recommend fall screens. So we know that patients in this age range, 65 or plus, once they have a fall, they are more at risk of having fractures. And once a patient has a fracture, their quality of life can change, because, if you have a fracture of the hip or of the spine, you're going to probably need surgery, you're going to need a rehabilitation, and all of that keeps you in bed, doesn't keep you as active. And so we really, really try to prevent patients from falling for those reasons. Now, the vaccinations in this age range, at 65, you should be getting your pneumonia shot. Everyone should be getting their flu shot as well. We do recommend the pneumonia, the 13, and the 23, depending on your health conditions. Everyone should get the 23, and then if you have other risk factors, you should also get the 13 as well. And so we're going to go a little bit into more detail about mammograms, since it is Cinco de Mammo, and I thought this was just a little bit funny. And I mean, I personally have not had mammograms, but my mom has, and so she thought it was funny as well. And so the picture says, that reminds me, I need to get my mammogram. And so, yes, mammograms are definitely, again, for patients and for my mother, not the most comfortable exam to do. However, they are extremely, extremely important, extremely important. Now, the reason why it's a conversation between you and your doctor as far as when you need to get screened is because there are many different guidelines. The American Cancer Society has guidelines. The United States Preventative Task Force has guidelines. the American College of Radiology, American College of Obstetricians and Gynecologists have guidelines. So, a lot of different guidelines. But the basic sum of all of these guidelines is between 40 and 50, you need to be having a conversation with your doctor. If you're an at-risk, person who has a lot of history of breast cancer in their family, especially diagnosed in younger ages, you need to probably start getting your screens about 40 or 45 years old. There is also differences between all of these guidelines, whether you should have your mammogram on a yearly basis or every 2 years. And so that really is, again, talking with your doctor. The radiologist, when you get your mammogram, a lot of the times, at the bottom, if it's normal, it says recommend yearly mammogram. And that is per their guidelines. Now, looking at, the USPTF recommendations at the bottom of the screen, they recommend women from 50 to 74 years old to get it every 2 years. And then other guidelines recommend that women from 50 to 55 get their mammograms yearly, and then after 55, as long as they're normal, start to get them every 2 years. Again, lots and lots of different guidelines to go off of, but really what is most important is talking with your doctor to see, am I at risk? Do I need to be getting these yearly? Can I space them out every 2 years? And things like that. So again, these are just some of the other societies that have these guidelines in place. But really, really important to start talking with your doctor, at least at the age of 40, to see if, you need to start at 40, do you need to start at 45? Do you start at 50? Do I get this once a year? Do I get this, every 2 years? Very, very important to talk about. And so something that I wanted to discuss as far as mammograms go is how how the radiologists score your mammograms. And so a lot of the times, these are, this is how we make our recommendations, is based off of the BI-RAD score. And all your mammograms will have this BI-RAD score on your report, and it stands for Breast Imaging and Reporting Data System. And so, if your mammogram is normal, you're going to get a BI-RAD score of 1, which basically means that it's negative, it's normal. You continue your regular screening, whether that be yearly or biannually or every 2 years. And then you have your category 2, which means they find something, but they know that this is, benign or it's non-cancerous. And so again, at the category 2, you continue your regular screening. In the category 3, that's where, they think that it's probably non-cancer, but just to make sure that it's not growing, it's not changing, it's not calcifying, it's not growing in little spindles, they recommend a 6-month follow-up for a mammogram. Sometimes even at this point, they may even recommend something like an ultrasound to get a better idea of what exactly they're looking at or what they're finding in the breast. Category 4, this is where they, suspect something is going on that may require a biopsy. At this stage, sometimes they also do recommend an ultrasound to get a little bit more understanding of what exactly, they're seeing on the mammogram. And then, category 5 and 6, this is definitely, they found something that is abnormal that is going to require a biopsy. Now, there's different people who do biopsies. General surgery normally is where I, tend to send patients for their biopsies. and then we take it from there. So this is just kind of a, how the mammograms are graded, and the system that the radiologists use to read your mammograms to say, is this something that looks normal, or does this something look like maybe it's abnormal, or something that definitely looks abnormal, and the steps to take afterwards. The other thing that can affect your mammogram is how dense your breasts are. And so there's different tissue that make up the breast. So there's fat, there's glandular tissue, and then there's connective tissue. And so based off of how dense your breasts are, is how well the radiologist is going to be able to see certain things. So the first, thing is, if your breasts are not very dense, they're mostly made out of fatty tissue, we can see things very easily. Number two is where your breasts are a little bit more dense. They have a little bit more of this glandular tissue. They have more fibrous, and all that is just different types of tissue that make up the breast. These tissues are normal. This is normal to have in your breast. However, when you have a little bit more of these types of tissue, it's a little bit harder to see, especially in the number 3 and the number 4. And there's even, times where the radiologist will recommend, depending on how dense your breast is, of getting things like ultrasound, and maybe even recommending something like an MRI, to be able to see things a little bit better if they have anything that they're suspicious about, or if they feel like they're not able to get a good look at things. And so for women who have breast implants, yes, you definitely can continue to get your mammograms. There's even a way for the technician to kind of push your implant up against your chest wall and try to have some of the rest of the breast tissue go onto that plate to get screened. But definitely, yes, you definitely still need to be getting your mammograms. And so just another picture. So make sure to check your Boobees. So little bees that are saying boo. I just thought it was funny. And then, so what are the indications to get, an MRI, instead of a regular mammogram? And so these are the women who have gene mutations like the BRCA1 and BRCA2 gene mutations. Someone, famous, Angelina Jolie, she came out that she did have these gene mutations and decided to get rid of all the breast tissue to make sure that she did not have, didn't develop breast cancer. And so these patients, we definitely recommend more of an MRI to get a better look. If you had history of chest radiation before the age of 30, it can make, there can be some scarring from that chest radiation. So MRIs tend to get a better look for patients who have that. And then anyone who has a lifetime breast cancer risk of 20% or more, basically we put your information into this risk assessment tool and see, are you really at very, very high risk of breast cancer? And do we need to be doing more intensive type screening with MRIs? And so talking about the DEXA scans, like I said earlier, everyone 65 and above should be getting DEXA scans. Now, this is something, if you are postmenopausal, under the age of 65, and you have a parent with a hip fracture, you currently smoke, you drink, 3 or more servings of alcohol a day, you have low body weight, you're on daily, steroids for your medical diseases, you have rheumatoid arthritis, all of these are things that we definitely, or you and your doctor should talk about, to see if you need a DEXA scan sooner than 65 years old. And so if you take a look, again, in that first category, everyone who's 65 and older should get, a DEXA scan to evaluate to see your bone status. Are your bones good? Are they weakening a little, or have you progressed to osteoporosis? And then again, if you are you are postmenopausal, you're under the age of 65 and have risk factors, this is definitely something that we can start doing earlier than 65. And this is, our little tool to screen for, if patients need DEXA scans earlier than 65, and it's called the Frax Score. And so basically we put in your age, your female, your weight, your height, any histories of fractures, parents with fractures, smoking, steroids, rheumatoid arthritis, history of drinking, 3 or more in a day. And so we get this score. And so if your score is greater than 20% risk of having a major osteoporotic fracture, or more than a 3% risk of a hip fracture, that automatically qualifies you to get a DEXA scan before 65 years old. And so just a little bit about the Cinco de Mammo at South Texas Health Systems. There is a promotion going on this month to encourage women to, get their mammograms this month. October is Breast Cancer Awareness Month. However, a lot of women tend to get it during that time because it's promoted. So this is a way that South Texas Health Systems likes to promote women getting it to where, everyone's not getting it at the same time. And so that's why they came up with Cinco de Mammo. And so for, patients who don't have insurance, your 2D mammogram is $55. That's your regular mammogram. 3D is only done at McAllen, and that is a little bit more expensive just because the radiologists are able to get more views in the 3D versus a 2D. And then your bone density scans or your DEXA scans at $75. There's different celebration dates and locations this month all around the valley. So this past week was at McAllen. This upcoming week will be in Edinburgh. The following week will be at South Texas ER and Mission. And then the last week of May will be in the South Texas System ER in Weslaco. And so we really, really, really encourage women to go out and get their mammograms this month. And go out and schedule your preventative exams as well, to be able to talk about, everything that we went through, especially for your age category, and to, make sure that we're taking the best care of you as possible. These are my sources for today. And then this is my little girl. She is 8 months old. This was her first Cinco de Mayo, and she just wants to wish everyone a happy Cinco de Mammo, and for everyone to go out and get your mammograms and your preventative exams.
Thank you so much, Dr. Gutierrez. Thank you for the presentation. At this point, we're going to start the Q&A session. As a friendly reminder, you can submit your questions using the Q&A forum in our Zoom webinar software. I do have a couple of questions ready, so I'm just going to go ahead and share my slide, and then we're going to start with the Q&A session. Okay, perfect. So the first question that we have is, if an ultrasound shows a cyst, can it determine if it's fluid or not? And if it's fluid, does that mean there's nothing to worry about?
So ultrasounds are very good at defining cysts. So when we see a cyst on ultrasound, what we look for on there is is there any abnormality in shadowing? Sometimes what we also do is we, get a repeat in about 6 months to see if the cyst is growing. Now, I can't say, I don't know the specifics on this specific cyst. I don't know if, there's any history of breast cancer in this patient. But normally, if we look with an ultrasound and the radiologist says, this is just a cyst, this is nothing to be concerned about, there's no calcifications in the cyst, it's something that we can monitor, with a repeat ultrasound, 3 to 6 months to see if things are changing, to see if it's the same, to see if it's getting better. But as far as, saying if it's completely normal, that really depends on the whole patient history, on what's going on at the time.
Okay, perfect. And I guess as a follow-up question, what is the next steps in the process if the ultrasound shows a cyst?
What is the next step? Is that right?
That's correct.
So normally if it just sort of shows a normal cyst, that's when we would probably recommend to repeat in a couple of months to make sure that, again, it's not changing. That's really what we recommend. If there's any concerns, we can always send to a general surgeon to potentially say, do we need a biopsy of this? Or can we just kind of follow this through repeat imaging?
Okay, perfect. Thank you. And the next question is, can breast cancer be hereditary?
Yes, so breast cancer definitely can be hereditary, which is why it's really important to let your doctor know if breast cancer runs in your family. Not only breast cancer though, if ovarian cancer runs in your family, if uterine cancer runs in your family, because those same cancers can be related to one another. And so definitely if breast cancer runs in your family, you would probably be someone who we recommend to start getting your mammograms at 40 instead of at 45 or at 50 to make sure that we're not missing anything.
Okay, perfect. And the next question is, when the imaging center orders an ultrasound following a diagnostic mammogram, what does it mean?
So there's a difference between a screening, first of all, there's a difference between a screening mammogram and a diagnostic mammogram. Screening mammograms are for women who are not having any symptoms, for women who we don't feel any lumps or bumps or have any concerns about. This is just a screening mammogram. Now, women who we, feel lumps or bumps, or women who say, I feel my breast different, or we see that the breasts are changing, we feel lymph nodes, that's when we order a diagnostic mammogram. And the differences as far as what the radiologists do, I don't have the specifics on that, but a lot of the times when we order a diagnostic, we put on the order, if you see something that needs to be followed up with an ultrasound, then they can do it right then and there. The problem is if we don't put on the order for a diagnostic, that if they see something that needs an ultrasound, you'd have to go back for it, which we don't want. We want you doing everything at that one time. So a lot of the times when women have, changes or the doctor orders a diagnostic mammogram, they'll put if ultrasound needed, in case they do find something that needs a little bit more information through the ultrasound instead of just through the mammogram.
Okay, perfect. And then the next question is, would you expand a little bit more on the HPV, please?
Yes. So there is an HPV vaccine right now, and it's been out for quite a while, that we recommend for girls starting at, as young as 11. And so basically, if we start the vaccines at the age of 11, it's a 2-dose series. And the hope is that when we give these vaccines to these girls that they will not have HPV in the future. Now, if you start your vaccines after the age of 15, you do have to have a 3-dose series. And again, the younger, the better. So the way that you get HPV is through sex. It is not considered a sexually transmitted infection or disease, but it is a virus that is transmitted through sex. So the reason why we like to vaccinate early is because we want to vaccinate girls and try to get, their immune system to protect them from the virus before they start having sex. And so that's the vaccination portion of the HPV. Now, HPV, like I said, you get through sex. A lot of the times women, young women, between the ages of 21 and 29, will clear the HPV virus and they'll never have it again. However, if you don't clear the virus, that does put you at more risk of having cervical cancer. And so that's why we start screening with HPV at the age of 30 automatically. And we look for HPV in younger girls who have abnormal cells on their cervix. The hope is that we get many young girls vaccinated, that we're going to start seeing less cervical cancer, or yes, less cervical cancer, because we're protecting them from the virus. I don't know if there's anything specifically about the HPV that they were
I
looking
think you
for.
answered the question
Okay.
perfectly, doctor. And I do
Okay.
have a follow-up question for that. Someone mentioned, I heard somewhere that we can get the HPV vaccine even at the age up to 47. Is that correct?
That is correct. It used to be up to the age of 26, and now they've increased it to the age of 47. Now, again, the vaccine is meant to prevent you from having the virus. And so if you have never had sex and you're like in your 30s or 40s, it'll probably do a better job than if you're someone who has already had sex and maybe been exposed to the virus. So we're trying to get ahead of you having the virus, but yes, there are new recommendations that say that we can give up to 47.
Okay, perfect. And our next question is, during a Pap smear, can you ask a doctor to see if there is a sign of the exam coming back at normal? They did mention withdrawal, so I'm guessing that they want to ask the doctor for a physical copy of the results of
I see.
the results.
Okay. So when we do a Pap smear, we do take a look at the cervix. Now, taking a look at the cervix does give us some information. Sometimes we see that there's more redness around the opening called the os of the cervix. And sometimes that means that there's a potential for there to be abnormal cells there. Sometimes that just means that you have some type of infection, like a bacterial vaginosis infection, a yeast infection that's irritating the cervix, or other things like, STIs, like sexually transmitted infections. We look to see if there's any discharge coming out of the cervix and things like that. We can't 100% say, unless there's something that looks extremely abnormal, that we see, very abnormal growths on the cervix right then and there, if there's some abnormalities, until we get the result from the lab. And then as far as getting a copy of your results, that's definitely up to your doctor. I know that I like to give the results to all of my patients to have for their records, if they want one. But on the report, it's going to tell you if you have abnormal cells, and if you had anything else checked. During the Pap smear, you know, on the same brush that we check for the cells on the cervix, we can also check for things like gonorrhea, chlamydia, trichomonas on that, and we can see if that comes back positive or not. But yes, you know, if your you know, you would have to talk with your doctor, but I personally do like to give the results to my patients. And sometimes we don't know if something's abnormal unless something is very, very abnormal until we get the report back.
Okay, thank you so much, Dr. Gutierrez. We do have a couple of questions regarding the mammograms. We do have a flyer on the Cinco de Mammo at Texas Health System, so feel free to email us at hidalgocountywellnessprogram.com so we can send you that flyer, and we also have the dates. This presentation is also going to be uploaded, so you're always able to go back and listen to this presentation. At this point, I would like to thank you, Dr. Gutierrez. Thank you so much for joining us and for this great presentation. I know that we all have learned a lot of valuable information regarding women's health and the importance of prevention and screening. I want to thank everybody that joined us today. I really appreciate your engagement and your time. And stay safe and healthy. And I hope you can join us for the next presentation. Thank you.
Thank you.